Assalamu alaikum. Sabah al-khair. Thank you so much for having me here. I really don't know where to start. I feel after Ms. Shayma, words have no meaning, really. This is very emotional, actually, to have so much talent, so much creativity in our region. It really gives me hope. And I'm sorry about being emotional. As Sir Michael started, we are currently in very grim times and in very difficult days with everything going on in the region right now, a region that is marked, unfortunately, by emergencies, with all what's going on in the occupied Palestine and Gaza. Thank you so much for having us here. Thank you, Your Excellency, Dr. Hanan. I really salute Qatar and the state of Qatar and all what you are doing for health and well-being, because this is hope. We will continue to be hopeful, to be optimistic, Sir Michael, and we will continue to build resilient communities, resilient cities, and resilient people. This region, I think, as I've always said, defines resilience. So with that, I will move on to my more mundane presentation, I think, and would like to talk today about how healthy cities in general, as a program, as a platform, will help with overall health and development and so many other goals, but specifically as we are getting very close to the SDGs deadline of 2030. We need, and as the clock is ticking, as we say, we really need to accelerate our progress on SDGs in the region, but of course very globally. So this is no conflict of interest, obviously. And I hope that by the end of this session, we will have a better overview about healthy cities, how healthy cities programs overall contributes as a multi-sectoral platform to the SDGs and to our overall program of work. I mean, just for people who are not very familiar with WHO, we are guided by our global programs of work that defines basically our work for a few years. Currently, we are towards the end of the 13th global program of work, and we are preparing for our 14th global program of work that will start in 2025. So I think you've heard all of this. I don't really need to repeat it, but as you heard this morning, almost 56% of the global population in the world lives in cities. Cities are attractive for various reasons. People come to cities to improve their lives and the lives of their children. However, cities pose very unique health risks. And as we know, especially in many urban slums, very crowded, even not just slums, I mean, very crowded cities. And we have seen this with COVID specifically, their significant contribution to the spread of infectious diseases, but also cities show very high rates of non-communicable diseases, including violence, which is not a disease, and mental illnesses. So all of this is why healthy cities are very important. So why do we have this whole program, Healthy Cities? Because we need, in addition to all the specific goals we have for SDGs, we need to have special focus on program focus in order to be able to achieve what we need. And the Healthy Cities program as such, that I will talk about a little bit more in details in a few minutes, has become a very important multi-sectoral platform to achieve health and sustainable development. We've been hearing a lot about One Health, multi-sectoral platform. It's the new buzzword, and specifically for the cities, this is really critical, because this is not just about health, it's about so many other sectors that have to work together. And the approach that we are using to reach the Healthy Cities definition, it catalyzes on political leadership, but also participatory governance overall. it's not moving. I guess this is an important slide, but it doesn't want to move. So healthy cities overall focus on creating and improving both physical and social environments and expanding community resources which enable people to mutually support each other in performing all the necessary functions of life, developing maximum potential. You'll see a lot of pictures as I go through the presentations with their legends, but many of these pictures are from countries in the region here, whether it's Qatar, Bahrain, Yarmouk, Saudi Arabia, many other cities, Iran. But what's overall our vision? The reason this we adopted this program in the Eastern Mediterranean region is to ensure that health, as we defined by WHO, not just the absence of disease, but overall approach to health and well-being is a priority for all relevant sectors of the society, not just to people working on health like ministries of health and many of us health professionals. Our role specifically within WHO is to support the countries, our member states, to put health very high on the social and political agenda of cities, to implement policies and programs to promote health, equity, well-being, and sustainable development. And we do not just advocacy with data, because our role as WHO is to make sure we have the evidence that is available and necessary to back up our claims. This is the current regional healthy cities network, and I keep saying this is one of the programs in EMRO that always gives me hope. I really would very much thank our team who has been working on this with Dr. Samar, Dr. Maha. They've really put a lot of efforts to expand this in the region despite all the challenges. So right now we have 22 countries in our region, as you have seen. Including most of the Arab world, but also part of South Asia. Right now we have 15 countries that have basically registered to be part of this, and 111 cities. So far we have awarded 35 countries in various 35 cities in various countries in the region have been awarded the certificate of healthy cities. We have currently 7 under evaluation, and we would like to have more. As you heard this morning, Qatar has all its cities. 8 municipalities have been awarded. If we had a definition for a healthy country, Qatar would be the first healthy country, and I hope we just don't have a definition for that. We are mainly working on healthy cities, so I hope we will be here again to certify Qatar as the first healthy country in the world. So, you know, what is really important, and it's too much probably details to go in this presentation, but Healthy City programs basically covers many domains as they are listed here, and altogether 80 indicators. Most of them are actually not health indicators. Most of them are related to these 9 domains or areas, as you see, whether it's community organization and mobilization, which is very critical, intersectoral collaboration, microcredit activities, you heard this morning about the cash transfers, education and literacy, very critical, health development, water, sanitation, food safety and air pollution, community-based information, skills development, vocational training, and last but not least for our region, and more importantly than ever, with natural disasters, other conflict, etc., emergency preparedness and response. 80 indicators. That's a lot of work, actually, to become a healthy cities. And once a city receives this, they had to meet all these 80 indicators. So it's very, very important. So I will try to cover how healthy cities contribute overall to the achievement of all the SDGs. We have altogether 17 SDGs. I will not cover all of them, but just to give you an example where there is a direct relationship between healthy cities programs and SDGs. Of course, as you all know, the first one, SDG 1, is no poverty. When we have, this is, you know, the mother of all ills, as we say, but as we have seen from Sir Michael's presentation, the inequities, but, you know, and healthy cities overall will lead to better development and better opportunities. But the importance for SDG 2, which is the zero hunger, Healthy cities criteria focus on ensuring access to safe, nutritious, and sufficient food by adopting innovative policy measures to improve food environment overall. As you see now, I think you're seeing increasingly more focus on healthy foods in various venues. When it comes to SDG 3, of course, this is the main one that is directly implicated. The SDG 3 is for health. You know, most of the indicators have direct implication, but they promote equitable access to quality healthcare services, creating enabling environment for healthy lifestyles, and overall health and well-beings for all age groups, for all genders, for all classes, you know, all people across the socioeconomic spectrum, and we have seen so many good examples promoted in countries that have been certified for healthy cities over the years. We saw examples during COVID specifically as well. SDG 6, which is clean water and sanitation, something that's on everybody's mind now. So healthy cities related criteria indicators ensure attention to increasing access to safe drinking water, improving sanitation everywhere, proper waste management, pollution control, and good hygiene. And also this links to the following one, number 13, for climate change as well. We see here examples of wastewater treatment, for example, in Iran, and also how do we manage water wells, etc., which many communities in the region are relying on now, wells as well. So also with sustainable environments and communities in cities, we focus SDG 11. This has been a big focus to increase access to green and public spaces, safe transport system, emergency responses to natural disasters, very important, urban planning, promoting physical activities. We still all have images of FIFA in our mind that we have not yet also forgotten. And last but not least, climate change or climate action, which is now one of the most acute things in our mind, and our region will be hosting COP 28 soon in Dubai. Healthy cities also aim to improve air quality, promoting physical activity, and also with many people living in cities, it's a major pathway overall towards climate change mitigation and policies for climate change. So I think this is my last slide here. Now we still have SDG 16, which I probably, again, this is very, very acute right now and very important. This is about peace, justice, and strong institutions. Healthy cities will be resilient and they are prepared to all emergencies. Healthy cities can recover quickly from emergencies. They will have better, more resilient health systems. They will also be better suited to eliminate violence, promoting intersectoral governance. SDG 17, which I will not talk about, is also the SDG for partnerships and collaborations, and also equity for everyone. And I would like to highlight here the Health for Peace initiative, which is an initiative that started in our region and now has become a global initiative that is being discussed currently at the World Health Assembly. Overall, I mean, I think it's, obviously for our program of work, we have three major pillars. We focus on providing health services, which is universal health coverage goals. We focus on protecting populations from emergencies and on promoting health. And healthy cities provide platform for all of them, the three of them, whether it's health, well-being, UHC, or emergencies, and also help building capacities to respond to all emergencies, including pandemics, including wars, conflicts. So, overall, I think these healthy city programs have proven to be a great platform to help countries and policymakers overall accelerate progress toward achieving SDGs. As I mentioned, we don't have a lot of time, 7 years left to meet many SDG goals. We are late on many of them, and of course, COVID even delayed us further, but we hope that the expansion of the Healthy Cities program will be very, very useful for making us stay on track and on target. So thank you very much for your attention.
Assalamu alaikum wa rahmatullahi wa barakatuh. Ladies and gentlemen, distinguished guests and fellow advocates for healthier cities, we have gathered today in this conference to shed light on an extraordinary journey. This journey has transformed Qatar urban landscape in a beacon of health and well-being. Qatar Healthy Cities program is not just a commitment, it is a testament to our unwavering dedication to the well-being of our citizens. Our vision for healthy cities in Qatar is powered by the National Health Strategy, the second, and FIFA World Cup 2022. This vision aligns with Qatar National Vision 2030 as well. Our ultimate goal is to maintain WHO Healthy City Awards for all municipalities, delivering sustainable and healthier living options for all. This effort mirrors our strong commitment to regional health goals and pursuit of high quality life. The Healthy City program isn't just about promoting the physical health. It embraces a holistic perspective. We prioritize mental, emotional, and social well-being, enhancing comprehensive wellness. Importantly, it also harmonizes with the Qatar National Vision 2030, targeting well-being, physical, mental, and social health, including those with disabilities. In our journey to accreditation, we condensed the multifaceted process in 4 important steps. The first step was formulation of Qatar Healthy City Network and City Coordination Committees. This phase was essential for community organization, partnership building, capacity building, and the strategic planning that underpins our Healthy City journey. Then we developed the Health City logo as a powerful symbol, reflecting our commitment for healthier options. The octagonal shape signifies the 8 municipalities of Qatar, whilst the base represents and reflects the importance of family and community participation and involvement. The colors and intertwinement embody the diverse area our program impact. Rooted in Arabic Islamic design, the logo resonates with our rich culture and heritage, underlining our commitment to healthier and culturally vibrant cities nationally. Moving to the second step, the Healthy City Network of Qatar collaboratively mapped out all initiatives related to the 9 domains of the Healthy City program and developed accordingly city health profiles and national Healthy City action plans. To showcase our dedication to innovation and sustainability, we invite you to visit the Spotlight stage. There you can explore the electronic Healthy City interactive mapping platform, which is a pioneering tool central to our program sustainability. The third and fourth steps encompass the assessment and the accreditation of each municipalities and 2 education settings. The first assessment, conducted in October 2021, encompasses the Doha municipality, Rayyan municipality, and Qatar Foundation. The second assessment, held in March 2022, extended to the remaining municipalities, Al-Wakra, Al-Shamal, Al-Khor, Al-Da'ayan, Al-Shahaniya, and Umaslal municipalities, as well as Qatar University. This assessment required meeting at least 80% of the accreditation criteria for successfully obtaining the accreditation. The award of Doha and Rayyan municipalities, along with Qatar Foundation, was achieved in December 2021. Subsequently, the remaining municipalities, in addition to Qatar University, obtained their awards in June 2022. Our journey has been marked by significant milestones. The first was on October 31, 2019. The Healthy City for Children Symposium took place. It aimed at combating childhood obesity and promoting physical activity. The event led to the Doha Commitment Statement, fostering a health in all policy approach, building on Qatar National Health Strategy and emphasizing equity and lifelong being. Yet another remarkable achievement was over-delivering our national target. Originally, the goal was to achieve WHO Healthy City accreditation in at least 1 community by the end of 2022. However, we have exceeded this expectation. By 2022, all 8 municipalities in Qatar received the accreditation of healthy cities from WHO EMRO, in addition to awarded 2 education settings. Our sport and health partnership represents another pivotal achievement. The Healthy Cities framework facilitated the implementation of the Sport for Health tri-party agreement between the State of Qatar, WHO, and FIFA. This collaboration played an essential role in ensuring a healthy and safe FIFA World Cup. Another key milestone is the Healthy City Interactive Platform, which provides a robust and sustainable framework for establishment and continuation of the program key initiatives within Qatar. Through this platform, various stakeholders can collaborate and leverage resources to support and advance the objectives of Healthy City programs, ultimately contributing to the health and sustainability of the community. Now we turn our attention to concrete examples of Qatar efforts that have played an important role in building the healthy city. Qatar commitment is evident through numerous outstanding examples, such as development and implementation of dietary guidelines tailored to the state of Qatar, promoting healthier eating habits. Implementation of WHO recommended 30% healthy food offerings in stadiums to encourage healthy eating during mega events. Expansion of green spaces within the city, promoting physical activity and outdoor recreation. The Friendship Benches initiative that encourages mental well-being and physical activity, and baby-friendly initiative which actively promotes and supports infant and young child feeding practices through promoting for exclusive breastfeeding. Integration of rigorous COVID-19 protocol across all sectors, reflecting science-led responses and intersectoral collaborations. Promotion of healthier food choices in school canteens for students, the development of Doha Metro and enhanced public transportation options such as the tram and Metrolink, reducing reliance on private vehicles. Public beautification which improves and enhances the functionality of central Doha area. Daily situation reports providing daily updates on relevant health activities and disease during the FIFA World Cup. Qatar National Sport Days, which is annual event, promotes physical activity and sport participation. Banning the use of tobacco and cigarettes inside World Cup stadiums, and excise tax for healthier society by implementing excise taxation on certain products such as tobacco and sugary drinks. Having achieved significant milestones with Healthy City, we recognize that it is just a start, another start and the beginning of our journey, and there is a lot to be done. So the next steps for the Healthy City movement in Qatar are essential to carry forward our vision and drive a greater change. First, we are actively contributing to the regional review of Healthy City criteria and guidelines, ensuring that our plans is aligned with the best practices in the region. To ensure the sustainability and continuity of our efforts, we are currently in the process of updating the structure of Qatar Healthy City Network. As we mentioned earlier, we are developing an electronic database and forum that will provide a platform for seamless collaboration across various sectors. This will enhance our collective goals and promote an environment of intersectoral actions. Healthy City Ambassador Program is another program aimed at raise awareness about our movement among a broader audience. We believe that engaging more individuals in our cause is crucial to achieve our vision. To ensure that our initiatives have genuine impact, we are focusing on strengthening, monitoring, evaluation, reporting, and research efforts. This is how we measure the health impact of our initiatives and improve our approaches. In closing, I would like to extend our appreciation to all stakeholders, other ministries, and our dedicated regional office and technical teams for their significant commitment and supportive efforts. It is through your dedication and partnership that we have been able to progress on our journey. Lastly, I would like to express our gratitude to all of you in the audience for your attendance today, and your presence and support are essential in driving forward our initiatives and plans. Thank you.